since I was married to him, always a stomach problem. He always had a stomach problem. We were getting ready for my son's winter concert, and Chris was out in the drum room and his studio practicing, and I had made fish for dinner, and Chris came in and said, "There must be something wrong with the fish you made. I feel really sick." And I said, "Well, everybody else here is fine. Nobody else is sick. Maybe you just have a stomach bug." So, and then I thought maybe actually he was even trying to get out of going to my son's concert. So I said, "Well, we have to get ready. We're just going to get ready and go. I guess you'll stay here if you have a stomach bug." And as I was getting ready, he was following me around the house, acting very, very strange, laying on the bed, kind of rolling around. And I mean, not to be too graphic, but I said to him, "Just throw up and you'll feel better." And he said, "I'm trying. I can't." So I said, "Okay, you're being a little dramatic." And we went to the concert. Midway through the concert, he called me and said, "I think you need to come back here. I feel like I'm going to die. You're going to have to take me to the hospital." So we had to get my son, who was at his winter concert for high school, had to go explain it to his chorus teacher. "I need to grab my son. We have to go. Something's wrong with my husband." And I get back here and I find my husband on the floor, trying to make himself throw up. And there was definitely, at that point, I thought, oh, something's wrong here. So I drove him to our local emergency room. And at that point, he started to have pain in his chest. And they bring him as a chest pain and they do an EKG, and his blood pressure is through the roof. And they order him a bunch of blood tests, and they're poking at him, and he's complaining of stomach pain. So I guess right after he got his blood test, he went in and got his CAT scan. So they made him drink the contrast, and they had given him some morphine, so he's a little bit more comfortable, and they made him drink the oral contrast. And I thought, this man is going to die. Like, every sip was just, and they brought him in, and he had his CAT scan, and that's when they brought him back out, gave him more morphine because he was in excruciating pain. And that's when the ER doctors, and I work at this hospital, they brought me to the side and they brought me into a private room, and they said, yeah, his blood test came back and there's something seriously wrong with him. His pancreas is inflamed. He already has fluid collecting on the outside. And they started to explain to me his lipase and amylase and all of his different blood test values that were through the roof. And at that point, I realized we weren't just talking about a stomach virus. And he was admitted to the hospital, and I had no idea. I'm a cardiac nurse, so I don't know anything about pancreatitis, not the first single thing about it. I know a lot about it now, but I knew nothing about it, so I didn't know, and I was following the directions of what they were telling me. He was admitted to the floor, to a medical surgical floor. I guess the practice is to just flood the body with a ton of fluid, and they did. And I stayed with him until about 4 a.m, went back to the house, got my kids ready for school, came back to the hospital, and I actually had to call a rapid response on my husband because his belly was so distended. His oxygen, he was sitting at about 86% on 4 liters. He was in fluid overload. I guess the fluid was just shifting. And I realized, oh, this is so much more serious than I think they are ready to handle in this hospital. The GI doctor came in during the rapid response, and I just realized when I met him, I just didn't feel comfortable. Like, my husband's in trouble here, because they were talking about surgery, and they were talking about terms like Whipple. And as a nurse, I know that term is a death sentence. I've taken care of patients who were status post Whipples from years ago, and they are, chronic pancreatitis, addicted to pain medication is one of the biggest things with these patients. There's so many things wrong with them, and they're disabled and not working, and their quality of life is horrible. A Whipple surgery is when they open up and go in and take the pieces of the pancreas that are disease infected, and then the patient and your pancreas, you need your pancreas to survive. So these patients are very, very sick after this surgery. They never, ever recover and go on to live normal, healthy lives. I didn't even know if there had to be another way, but when they started using those words, it was, you might as well just tell me that he's going to die, because that's what I was preparing for, because I knew that they don't do well. Actually, sadly enough, I thought it would be better if he just died, because what I have witnessed myself as a nurse, taking care of patients who have had Whipples, their quality of life is just horrible. And I know that's not what he would have wanted or needed in his life. I mean, these people are just chronically sick, always in the hospital, addicted to, pain medication because they're always in pain. So when I heard those words, to me, I didn't know anything about there being any other way to do anything, because nobody at the hospital was saying anything other than wait and see, let's give him fluids. And the crazy thing is, from, after, working with Dr. Kahaleh, is they were sending him for CAT scans and having him drink more of the contrast and then putting him on a diet. They actually advanced his diet once they got his pain under control. And now, having, worked with Dr. Kahaleh, knowing that we should have been, not every time you put anything in his mouth, you were just activating all of that again. I was just on survival mode of trying to get back into the hospital and speaking to enough doctors there to kind of get an idea. The intensivists, I just felt, they didn't know what to do. They were just consulting out surgery. And then the surgeons were coming in, and I just knew I can't have him have this surgery. There's got to be, even though I didn't know there was another way, I was really so afraid for him to have that surgery, because I knew once he had it, there's no going back. You can't undo that surgery. And I was just, I don't know. It was just a very, very lucky break for us that my husband's friend is a doctor who's also very aware and in tune and up to date of what's happening in so many different fields all over. And he was the one that referred us to a doctor who then referred us to Dr. Kahaleh. And from that point on, the wheels were just in motion to get my husband out of this hospital and into a place where he could have this possibly taken care of without having his belly opened in surgery. I called my friend's husband, who is a physician, and he was able to put us in touch with Dr. Kahaleh. And once that happened, the wheels were in motion to move my husband out of this hospital to a facility where Dr. Kahaleh could do what he knew to do to save my husband's life. I was trying to get Chris transferred. Then they were being actually ridiculous at Mather, and they weren't going to write discharge orders. So I luckily, had a friend and I got the administration involved, and they did. And then they weren't going to arrange for transportation. My husband's friend, who's a physician, didn't want to come in and start stepping on everyone's toes, kind of observed for a few days and saw what was going on and realized how sick, and Chris was getting sicker and sicker and sicker. He had C. diff. He was just getting worse and worse. And that's when, John was actually in the room with me when one of the surgeons came in, and John said, so what's the plan? And they said, well, he needs surgery. And John said, there are other options, other places. And that's when these doctors said, no, there's not. There's nothing they can do anywhere that we can't do here. And John said to these doctors, you don't know what you're talking about. So the doctors at the hospital where Chris was initially admitted were telling me that they believed the only option would be surgery. And they were having their surgeons come in and consult, and they were going to run some tests on Chris. And that felt like it was starting to get out of control. They were starting to come in 2 to 3 times a day and ask for this test and that test. And I knew that they were getting ready to, put him on the schedule, the OR schedule. And I just felt like this is not an option that I wanted. And nobody was really talking to me about any other options when I would ask, well, what else besides surgery? And they would tell me nothing. And then I'd say, well, I want to speak to the GI doctor. And he would come in and he would just say, there's really no other option. And that's when a friend of my husband's, who was also a physician, knew of other options that were being done in hospitals in the city. And he was able to put us in contact with Dr. Kahaleh. So my husband had a friend who was a physician who knew that there were other options being done at other hospitals, and it wasn't going to happen at the hospital that we were in. So that's how he put us in contact with Dr. Kahaleh. Chris was in the ICU, and the surgeons were rounding on him. A friend of our family, Dr. Byrne, came in and informed me that there were other procedures being done, less invasive procedures with better mortality, that were being done that could help my husband. And that's how we ended up getting in touch with Dr. Kahaleh. Then the ball got into motion of how to get him transferred, how to get an accepting physician at this hospital, getting the doctors at the hospital Chris was at to write discharge orders. And again, we were kind of hitting a brick wall because they were telling me that we can do anything that they can do there at this hospital, which wasn't the case. But we just had to get him transferred, and whatever it took. And in the middle of the night, they came and they picked up my husband and they brought him to Dr. Kahaleh. And we met Dr. Kahaleh the next morning, and everything from the moment we met him in the endoscopy suite, and he said, it's going to be okay, and assured us that we're going to be laughing about this in a few years. From that point on, it was like the biggest weight was taken off of my shoulder because I didn't have to fight anymore. And I'm going to get teary-eyed. Because in the other hospital where they were telling me there were no other options, I just felt like I was fighting for his life. And now we meet Dr. Kahaleh, and I was like, oh, somebody else is going to do the fight for me. They're going to take care of him. And it was just like I was able to go home that night and sleep for the first time. Oh, Dr. Kahaleh met us in the endoscopy suite. My husband was so miserable at that point, in pain and just miserable. And Dr. Kahaleh met us in the endoscopy suite, the biggest smile on his face, and said, it's going to be fine. We're going to take care of this. We're going to be laughing in a few years. Led us to believe I've seen worse. Yours is not a great case, but we're going to totally take care of this. It's not, and he definitely told us right from the beginning, this is not something that happens. We're not going to fix this overnight. It's going to take some time, and, just trust me, and we're going to get there. And you couldn't, if you see my husband today from what he was that day, it's day and night. Relief, that finally somebody knows what they're talking about. I just felt like for 7 days, I was just fighting with the other physicians because they just wanted to ask me, how much does my husband drink? That's why he has pancreatitis. Or I felt like they were just not hearing me. And so I felt relief that this was going to be taken care of. Yeah, it was the best. It was the best feeling. I think I was able to go and sit in the waiting room and be like, oh, thank God. And I still didn't know really what was everything that we were in store for, but it was just relief that somebody knew exactly what was wrong with my husband, because at the other hospital, I think there was still questions of how it happened, why it happened, what do you do about it? And when I met Dr. Kahaleh, he said to me right away, I know exactly how it happened and why it happened. It has nothing to do with that he drank too much. It has nothing to do with any of those things. It has to do with the fact that, his gallbladder is bad and he had sludge and this is what happens. And it was he simplified things for me. And I just felt like, oh, this is going to be taken care of. Dr. Kahaleh just said, I can tell he doesn't drink. Look at him. He doesn't look like he just doesn't. I mean, he's not. I just know. So that never came up again with Dr. Kahaleh. The conversation, I was never asked. At the other hospital, every single doctor that came in the room wanted to know how much he drank. And my husband's the type that drinks a glass of wine a month. And I've known my husband for 30 years, and it was so frustrating that that's the only thing they were focusing on. And so I brought it to Dr. Kahaleh's attention that day in the endoscopy suite, and he said, I know he doesn't drink, so end of story. There's no conversation. That's not what it is, and moving forward, we're going to take care of it. So it was just somebody else was hearing me, and also, but knew and took it very seriously, but has also done this procedure before, and so that was so comforting to know that, my husband wasn't the first. I don't know if there was milestones, but it was coming to terms with acute necrotizing pancreatitis, or pancreatitis itself is not a fix it overnight condition. When we met Dr. Kahaleh in the endoscopy suite, he was able to tell me he knew exactly what was wrong with Chris, what was wrong, how to fix it. It was going to be okay. It was going to take some time. All the things that I had been asking were being answered in a 5-minute conversation in the endoscopy suite, with his scrubs on and everything. And so that was just such a relief to actually have words, for me as a nurse. Then I could go and I can look up all those things that he was telling me and Google all those things. But that was to have words, to put words to what was happening was really important for me as a nurse, important for me, so I could just wrap my head around it. Chris was diagnosed with acute necrotizing pancreatitis, which is when the pancreas becomes so infected that part of it necroses or dies. And when that happens, the fluid leaks out and surrounds, and you end up with fluid leaks outside of the body, outside of the organ, and that can become infected, and you can die from that pretty quickly. You can end up becoming septic from that pretty quickly. And I believe Chris was becoming septic already. I remember looking at his white count was into the high 20s. When we met Dr. Kahaleh in the endoscopy suite, we were still, prior to meeting him, there was still, how is this going to be fixed? What's going to happen? How long are we going to be here? When is he going to feel better? And meeting him in the endoscopy suite and him telling us, I've reviewed all your films and we're going to drain the bile duct, or clean the bile duct, drain the infection, and put in a feeding tube. And that was done in the 2 hours that he was having his procedure done. So when Chris came out of that procedure, it was, we already had 3 of the major things that we were anticipating already completed. And knowing that the infection was drained, when you have an infection and that's inside of you, knowing that was drained was huge, because we knew, okay, we're on our way to recovery because we're getting rid of the infection. And also, Dr. Kahaleh told us, Chris is not going to be able to eat. So having the feeding tube, and that was a little adjustment for Chris and myself, knowing that he's going to be fed outside of his, not putting food in his mouth. He's going to have food put into his stomach through a tube. And that was all, done within those 2 hours on that first day that we met Dr. Kahaleh. So he moved so quickly, and every single time, we met with him, there was always something being done that were moving and propelling Chris in the right direction. And, it was just, we consider it a godsend that, he came into our lives. So Chris was in the hospital for approximately a month after that first procedure that Dr. Kahaleh did, and he was being treated with IV antibiotics. He was adjusting to the tube feedings, and then we went home. And a couple of days after we were home, he ended up having to go back in because one of the fluid collections that he had that hadn't been completely drained needed to be drained, and we did need to go back in and have that done. So there was a couple of times that we needed to go back in, and Chris needed to have other procedures done. But everything was pretty much going as planned, I believe. There's always going to be, Chris had a very severe case of acute necrotizing pancreatitis. And so we were always led to believe by Dr. Kahaleh and his team that this was just part of the process, and just be patient and it will all work out. And it did work out. Oh, and he had a leak in the pancreatic duct. It's fluid collecting outside of the organ. That fluid, it shouldn't be there, so it becomes infected. And if it becomes infected, you can become septic and die. So it needed to be drained again. So Chris had to go back in. And again, it was all part of the fact that Chris had a very severe case. Part of the process of what Dr. Kahaleh does is that he doesn't just send you home and say, okay, see you in 6 months. We're going back in. At the beginning, it was weekly for an MRCP so that he can monitor what's going on. He doesn't just send you on your way. So he was able to continue to monitor everything that was going on even before my husband maybe became symptomatic, and know that, okay, now I can see a little bit of a leak. I need to have you come back in. So we were always being watched and monitored, which was very comforting. And Chris did have another leak in the pancreatic duct, and he did need to go back in and get drained. And from the patient's perspective, that's a little sometimes upsetting because they just want to get better and they want to be better. But Dr. Kahaleh always would meet us at our appointments, and always with a smile on his face saying, you're going to get through this. It's going to be okay. And we did. He did get through it. And, these are the little setbacks. But again, Chris had a very severe case. So these setbacks were almost anticipated, expected. And everything worked out, though. Pretty devastating knowing he had to go back into the hospital, because as the patient and the family, he's leaving to go back in. The kids are upset that he's leaving to go back in. I was traveling into the city. So it was pretty hard on us as a family. And then there's always, anytime anybody's in the hospital, you worry. And then is this the last time? Is this the last time? And it's, you're trying to juggle kids and the whole family. And so, when he would have to go back in as a family, it's pretty devastating because it changes everything. And then you got to call in all your family to help you. And the patient, Chris was starting to get to the point of being a little depressed. He hadn't eaten. He can't play his drums. He was sitting on the couch 24 hours a day, pretty miserable. So those moments can be pretty tough to get those phone calls. It's time to come back in. Because getting Chris there is not easy. He's got the feeding tube, and we had it hooked up, and I was pretty adamant on making sure that he was always getting his feeding tube, so I never had it turned off. It was always running slowly. And so, it was, I think I might block out some of those memories because they were pretty devastating some days, but I try and just think, okay, well, we got through it. Chris was released from the hospital after being there for a month. He seemed to be doing okay, adjusting to the feeding tube and adjusting to life at home, being in a hospital and having nurses taking care of you. Now you're on your couch or in your bed and trying to adjust. And then within at least 2 to 3 days, he started to not look so good. And I actually went into my job and worked a few hours, and I had my family members here taking his temperature, and it was starting to climb. And I called Dr. Kahaleh at 10 o'clock at night. I called his service, and he called me right back. And he said, you're going to have to come back into the hospital. It sounds like it's infected again. And that was devastating for me because we had only been home a few days. I think I got my hopes up that we were going to be home longer than that. And I was exhausted. And just as his caretaker, I knew I had to break the news to him and tell him we were going back in. And that was pretty bad. And especially it was February, freezing cold, 10 o'clock at night, and we have to get in the car and go. And when I got home, he was so sick. He was starting to vomit, and he had high temperatures, and he looked really bad. And so I was worried. So that one was the biggest setback. And that one was very scary for me because it seems like he was back to where he started almost. So that one was tough. Chris would have his, weekly, monthly MRIs, MRCPs, and we would go in and it was always like, so can he eat yet? Can we, and we did. I remember, I don't know where in the timeline of this is, but so it's got to be sometime the first week or two of March of when he said he can start with a clear liquid diet. Well, we left there, hit the first Chinese restaurant around the corner that served broth. And we have a picture of my husband, all, skin and bones, slurping his broth like it was a filet mignon. And it was the funniest thing. People at the restaurant were like, wow, he's really enjoying that. I'm like, no, you don't understand. He hasn't had anything to eat in 3 months. So it was pretty that was a pretty big moment, when he could eat that. And then it was everything. Once he was able to advance then to fulls and he could have yogurt and things like that, it was like having a baby and advancing their diet. And it was pretty big. Those were cool moments. And then on his birthday, March 24th, we had everybody here and we had a little tiny cake, and he did take a few bites of the cake, and that was, that was big. Today, Chris is absolutely fine. He's he's diabetic now due to, the results of the pancreatitis, which we knew was probably going to happen. And that's well controlled and very easy to manage. And he's great. He gained all the weight back and some. Actually, I've dated my husband. We dated 10 years before we got married. We've been married, it'll be 21 years in September. And from the moment I started dating my husband, he had what everyone considered was the Marshak stomach, because everyone in his family had, what they thought was irritable bowel or always running to the bathroom, pains in his stomach, and he couldn't eat this and he couldn't eat that, and he was always suffering. And from the time that Chris, after March, Chris has no issues with anything that he eats. Chris never, ever has a stomach issue. Chris never has a pain in his stomach. Chris never is running to the bathroom. So, would I do it all over again? No, probably not. But the fact that he has no issues with his stomach anymore, it's like he's cured and then some. In addition to being a brilliant physician, he's also extremely kind. He's also extremely encouraging. He cares about his patients and I'm a nurse for 20 something years, and this is a man that cares about his patients and cares about the future of where this is going, that people don't have to have open surgeries to take care of what Chris had. He really is trying to get that message out. And my husband sends patients to Dr. Kahaleh that call up Chris and say, hey, I have a friend that has this. And Dr. Kahaleh takes every phone call that Chris makes and every referral that Chris makes, and has helped so many other people. And so there's just, I don't know, there's no words. Thank you doesn't seem like enough.